When we first got started thinking about affiliation, the board had certain specific criteria that they were looking for. How do we keep care local, for one? How do we keep our community being able to be served here locally?
How do we deliver the highest quality of care in this kind of a remote location? How do you do that? And so telemedicine and all those avenues of technology provide that access to the highest level of care, whether that's specialists from Midland, whether it's specialists from the university, whether it's just partnering on conferences and determining best practice. Those are all modalities that telemedicine and technology afford a place that's this far away from everybody else.
And then the other piece that I would say that the board was interested in was what we would call as quaternary care. And that means that you would want to be able to provide all care within the system. And so if somebody was really sick and needed subspecialty care, let's say a child got burned very severely and needed to be hospitalized, you would want to be in a system that could provide that care. And so with our affiliation with MidMichigan Medical Center, or MidMichigan Health, and their affiliation with the University of Michigan, we can provide local care here, and then any subspecialty care, 99% of all care can remain within the system. We've heard so many times from people in our community that they don't want to have to travel outside for health care.
All that added cost to our demographic types of patients is a real burden.
And so our board of trustees has done a terrific job of trying to bring those services here, but sometimes those services are going to be done by telemedicine.
And so providing that care locally, they get the care they deserve, they get the care that's accessible to them without the out-of-pocket cost that can be difference makers in how they feed their families. So
we're going to see more and more telemedicine. There's going to be more equipment, types of equipment that understands the functioning of the body, and physicians will be able to practice remotely and do just as good of a job as they would face-to-face.
I think one of the areas that we continue to work towards is pediatric support, simply because it's tough to travel with kids. All services that we are too small to provide that kind of specialty physician in our community, but partnering with MidMichigan Health and adding all of our volume together, we can provide that service here locally. I think telemedicine and the application for iPhones, et cetera, or your electronic device to be able to provide that data, that input in your home or in your place of work are going to be key components to improving the health care for all, and not only our community but across the country.
Thank you for watching one of many short videos in our new telemedicine mini-series. I encourage you to watch the remaining videos as they are published. Each of these will highlight just one more way that MidMichigan Health and its partners are providing access to healthcare in our communities. For more information, please visit our webpage at midmichigan.org/telemedicine.